Hello, everyone. I'm Dr. Kara Wada, board certified in allergy, immunology, lifestyle medicine, also life coach. And I've been helping people with allergies, asthma, autoimmunity, and misbehaving mast cells take control of their lives for over 14 years. As an autoimmune patient with Sjogren's myself and a former food allergy mom, I understand these challenges firsthand. Today, we are talking about something that affects a lot of people: chronic hives and swelling, officially known by those of us in the field as chronic urticaria and angioedema. And if you are one of the millions who live with the daily frustrations of itching and the swelling that these conditions cause, I'm here to offer you some hope and some helpful strategies for finding relief. So let's understand the difference between hives and swelling, starting with the basics. So chronic hives or urticaria are these itchy raised welts that can pop up on your skin. They can be very tiny, as small as a little pinpoint, or all the way up to quite large, big plaques covering our trunk, our legs, those bigger areas of the body. And these can occur anywhere from the top of our head to the bottoms of our feet. When hives are sticking around regularly for more than 6 weeks, this is the point where, as allergist immunologists and as other healthcare professionals, we say, okay, this isn't just a short-term thing. This is considered now chronic urticaria. It's essentially a line in the sand that we kind of made up at some point, but it helps us understand the different causes that may be triggering these hives and resulting in them sticking around for a bit longer. Angioedema is swelling, and it can occur when allergy cells that are a little deeper in the skin get triggered. It also can be triggered by another system called Bradykinin. We will get into this later, but essentially this can be sometimes a bit more painful, can be itching, sometimes have a burning sensation because there's so much swelling in the tissues. Angioedema will often affect areas in our face, like around our eyes, our lips, our tongue, rarely our throat, our fingers and toes, in part because these areas are very vascular, meaning there are a lot of blood vessels. So when inflammation takes root, when these allergy cells or other cells start releasing chemicals, that results in a lot of leakage of fluid from our blood vessels and a lot of tissue swelling. So in areas where there are more blood vessels, like around our eyes or our lips, we will see swelling as opposed to hives, spots, or bumps. So how often does this happen? Are we seeing a hidden epidemic? Chronic urticaria affects approximately 1% of the population at any given time. That's 1 out of every 100 people is dealing with these itchy rashes that come up seemingly out of nowhere. Angioedema may affect upwards of 7% of all of us sitting here across the globe at some point in our lives. These conditions can have a big impact on our quality of life, affecting our sleep, causing anxiety, depression, disrupting our work and social life. A little hard to go out on that date if you're really swollen or itchy, right? If you are struggling, please know you are not alone and your symptoms are valid, and I am here to help. Let's talk a little bit about the culprits. Let's unmask some of the causes and triggers that may be resulting in these itchy hives or these swollen areas of our body. Often it's a combination of factors that are going on. At its core, what is happening is our immune system is being turned on. This is inappropriate inflammation. Often it is triggered by our mast cells. They are our body's border guard cells. And for some reason, they have been alerted that there is a danger signal, inappropriately so, but they have been alerted. And when they release the chemicals that are inside of them, that results in the formation of a hive bump or that swelling in our lips, our eyes, or some of those other areas that are more prone to resulting in angioedema. In some instances, our immune system has actually created substances like autoantibodies that are triggering our own mast cells. This is the case in many people who have chronic spontaneous urticaria. We also know that other things and other factors are really common at triggering these cells to react or respond when we really aren't in danger. A few of those things are infections. Very often we will see a surge or an increase in hives about either during a viral infection or several weeks after a viral infection, as the immune system is trying to finish up that cleanup process after we fought off the initial infection. Rarely, parasite infections can be implicated, but this is much less often than TikTokers will make you think, especially when we are in areas that have clean water supply, like we are, lucky to have where I am here in the US. Medications, certain pain relievers like NSAIDs, which include ibuprofen and naproxen, can target or add lighter fluid to the situation in about 25% of people who have hives. And for some people, this can be an irritant to mast cells and result in lowering the threshold for having hives or angioedema occur. Stress, for some people, again, for most of us, stress is lighter fluid on the situation. If you have some sort of chronic inflammatory process, having stress is just going to turn up the dial on whatever flavor of inflammation is going on. So if you're dealing with hives and swelling, that may be a trigger for you too. Physical factors are huge. Temperature changes, taking a really hot shower, going out and shoveling snow, coming back inside and warming up, pressure on the skin, areas of tight clothing, so waistbands, bra bands, tight socks, like compression socks that many of us wear if we're dealing with dysautonomia, POTS, and different things where our blood pressure tends to be unstable. And even exercise for some folks can be a trigger for urticaria and angioedema. It's less often that foods and food additives are true triggers for hives, chronic hives and angioedema, but there are some folks who have difficulty breaking down histamine, something called histamine intolerance, that may see a relationship between foods that are naturally higher in histamine and a flare in their hive symptoms. This is not as common as we might think, but it does play a role for some folks. Histamine intolerance, I like to think of similar to lactose intolerance, where our body is just not doing a great job of breaking down a substance that is naturally found in many foods that we eat. So let's talk about the symptoms from itchy to intense. With hives, we often will see itchy, raised red bumps. They typically may be warmer to the touch than on unaffected skin. They can pop up anywhere. They usually will last no more than 24 hours. If they are lasting longer than 24 hours, or if someone is having bruising after they resolve or as they're resolving, these are reasons that I might refer a patient to go see one of my dermatology colleagues to have a biopsy to look at this inflamed tissue under the microscope and look for additional inflammation around the blood vessels called vasculitis. There are certain flavors of urticaria that are a little more serious, and one of those is urticarial vasculitis. So if you're seeing bruising or feeling burning in the skin, those lesions are lasting longer than 24 hours. These are all signs that you need to be checked out and connected with the right healthcare professional to help you personally. All right, acute versus chronic. So yes, I mentioned that there is this proverbial little line in the sand. At 6 weeks, it says, okay, it's no longer acute, now it's chronic. I will say in clinical practice, I am typically thinking that a patient's symptoms are going to play out more like chronic hives if they are sticking around for more than even a few days. Because when I think about acute urticaria, typically what's happening is someone's having a true allergic reaction. They ingest a medication and they have hives develop within 30 to 60 minutes. They have food that they're allergic to. They have a reaction right away. These are very acute settings. You get a sting and then you develop hives after the sting, right? Very closely tied to a specific event that very easily you can be, the Sherlock Holmes with your detective hat on and put that together. More often when I see folks with chronic hives, they have racked their brains for weeks, if not months, and sometimes years, trying to find connection between things they're doing in their lives and their symptoms. And they have tried to look into every variable with varying levels of success. And I always tell them, if you have racked your brain and you have not come to really great conclusions that we, kind of go through together, then more often it is this autoimmune or autoinflammatory process going on. When we talk about the angioedema, as I mentioned, this is occurring a little deeper in the skin and in areas that are more vascular. So more blood vessels are there. It might feel painful or tight, often is affecting the face, eyelids, lips, tongue, as well as hands and feet. And it's important to understand, though, if angioedema is lasting longer, greater than 48, 72 hours, then I am thinking about specific types of angioedema that are driven by a different process than those mast cells. So the angioedema associated with mast cells tends to occur a little more quickly and resolve a little more quickly. There's another pathway that can result in swelling, and this is driven by a different chemical process, a substance called bradykinin. This longer lasting and a little bit slower onset angioedema can be caused by certain medications, most commonly ACE inhibitors, type of blood pressure pill. There are some people who have a hereditary form passed along in families, typically in a dominant fashion, called hereditary angioedema. And then there are, a few other outliers that can be related to other health problems. That's really important to see a board certified allergy immunology doc who has some interest and understanding of angioedema to help you tease through this with your specific symptoms and health history. So there's always a lot of concern about the danger of angioedema because what if that swelling affected your voice box? That's really scary, right? And we know that that can be a significant problem and worry with a true allergic reaction. I will say, one of the most anxiety relieving things I can talk to my patients about, my patients who have, what we have determined together is playing out like chronic urticaria and angioedema. They often happen together is that this condition very rarely, very, very rarely affects the throat. And so that is one thing that I love being able to share with patients because, gosh, what a relief off their shoulders to know, hey, I don't have to worry about when that other shoe is going to drop and when my throat's going to close and I'm just going to keel over. If at any point, though, you have these conditions and you do feel like your throat is affected, this is a really important time to call 911, ask for help, and get that immediate assistance. It is better to overreact and over-respond, figure out the story on the back end, rather than not respond in a timely fashion. So how can we find answers? How do we diagnose this? How do we treat it? First and foremost, we have to put our detective hats on. The most important part of medical treatment and training and understanding is getting a thorough medical history. If your doctor is not spending enough time, getting that history, getting those clues out and understanding, then that's a little bit of a red flag. So how long have you had the symptoms? What potential triggers have you identified or are you worried about? Are there any other symptoms you're experiencing as we think about head to toe? Important to take a good, what we call review of systems, kind of a quick scan across the body. What else is going on? Do you have a family history of these sorts of things happening? And what treatments have you tried? And have they helped? Have they taken the edge off at all? Then a physical exam can be helpful. Often this can be done, by kind of visual inspection, looking at your skin, looking at pictures of your hives and swelling. So take a few so that you can bring them with, because I will say it is not uncommon that patients will say, gosh, I have had hives or swelling every day for the last 90 days. And my appointment was today and it's gone. I think that sometimes we have a bit of that fight or flight response, which tends to suppress hives. That acute response does. It's our body's natural adrenaline, it's like an EpiPen, essentially, in a lower dose in our own body, but that tends to calm hives down. So having pictures can be helpful. Depending on that medical history and that physical exam, that is going to guide potential testing. Oftentimes, we actually don't need to do any extensive testing for chronic hives and urticaria. It's a clinical diagnosis, meaning we take your history, we take your physical exam, and we say, yeah, as long as you are responding to treatment and you don't have any red flag symptoms, that's all we have to do. Now, I will say occasionally, if we're suspecting a particular allergy trigger, or if you have a worry kind of weighing on your mind, like, I think I might be allergic to this, then often I'm going to work with patients and say, yeah, let's check these things. It's low hanging fruit. Let's just make sure, kind of reassure ourselves that everything looks okay. If someone's having other symptoms as we've gone through that review of symptoms, then we may check for, is your thyroid working okay? Do you have vitamin D deficiency? What other things might be going on that might be contributing to making these hives stick around longer than they should? So how can we manage symptoms and find some relief? Well, the goal of treatment is to calm down these overreactive cells, minimize the itch and swelling, and help you get some much needed relief from symptoms. Because often, if these symptoms are interfering with sleep and you're having sleep deprivation as a result, that's just adding further insult to injury. It's adding additional fuel to this inflammatory fire. Our first line treatment often is using long acting, less sedating antihistamines. And occasionally we will push those doses up to about 4 times what the typical on the box would be. This is something you are going to want to talk specifically with your healthcare team. This is not medical advice specific for you. This is just for educational purposes, but often we will use these in order to essentially close the gates on these cells. And think about if you were on a farm, you want to keep the horses inside the barn and not go chasing after them afterwards. So, using long acting, less sedating antihistamines like fexofenadine, cetirizine, loratadine can be quite effective. Occasionally, we'll step up treatment, use an H2 blocker. This is often famotidine in the US. And occasionally, we have all sorts of other tools in our tool belt. I'm thinking about what are some lifestyle factors we can add in and help improve and make a more anti inflammatory lifestyle. And if these aren't cutting it, we have some really great tools in our toolbox. I am very fortunate that vast majority of my career, I have had access to get my patients on omalizumab. The brand name is Xolair. It is an injection medication that helps turn down the dial on allergic inflammation, can be a huge game changer and help put patients into remission that are dealing with chronic hives and angioedema. Occasionally, we will use medications that are a bit more immune suppressive, things like cyclosporin, dapsone, sulfasalazine, hydroxychloroquine is not quite immunosuppressive, but sometimes is helpful, and dapsone. All of these are other tools in my tool belt that I've used over the years to help patients with really stubborn hives and swelling. There also are several drugs that are in the pipeline, so in phase 2 and phase 3 clinical trials that are really geared towards helping those with especially refractory hives and swelling to help them get relief. And one other medication I forgot to mention, but we will often give a try, is a leukotriene inhibitor or blocker, typically montelukast. This is important to talk with your healthcare professional about because there is a black box warning that it can affect mood and cause changes in mood. So important to talk with your healthcare professional so that you understand those risks and potential benefits before starting. Emergency treatment. So typically, if someone is dealing with chronic hives and swelling, prescribing epinephrine pen, like an EpiPen, is not necessarily standard of care. I think it is helpful, though, to meet each patient where they are, talk about their personal history, and then decide if that is something that would be helpful for them or not. But it would not be standard of care for everyone with chronic hives to have an EpiPen. Living with chronic hives and swelling, let's dig into some practical tips. 1, you are not your condition. It is crucial to remember that you are not defined by hives or by swelling or not looking like yourself or feeling like yourself. And you can find ways to manage these conditions and live a full, joyful life in spite of and along with your hives and swelling. So here are some practical tips. Identify and minimize exposure to your particular triggers if you are able to identify those. Find ways to more positively manage stress. Stress is an inevitable part of our lives and our experiences as humans, but we are not always taught how to deal with those ups and downs that will happen across the span of our lives. Filling your toolbox with different techniques that help you more positively manage stress can be incredibly helpful at turning down some of that lighter fluid that may be adding to chronic inflammation. Get regular exercise, eat the least restrictive diet as possible, aiming for a rainbow of colors and good, healthy sources of omega-3 fatty acids, vitamin D. All of these things are really helpful at providing your body all of the ingredients necessary to help it reset and kind of recalibrate and get back to what we call homeostasis, this beautiful balance point when our bodies have the ability to figure things out when we give it the tools and opportunity to do so. Really, this is about finding relief and reclaiming your life. It's about finding what works best for you. You have to be a scientist in your own care, often with the guidance of your healthcare professional. Living with chronic urticaria and angioedema can be a long-term challenge for some, but you can find ways to live a full and healthy and active life. Support groups are wonderful for connecting with others who truly get it. Be sure to join my free Facebook group, the Becoming Immune Confident community, a safe and supportive space to connect with other autoimmune and allergy superheroes. And to prepare for your next doctor's visit, you can download my free Immune System Disorders pre-appointment workbook. It is packed with tips and questions to help you make the most of your next appointment. I'll put the links in the description below. And if you haven't heard already, I am getting ready to launch my new telehealth practice. If you aren't on the waitlist already, you should hop over and put your name down. In part, this is helping me understand where you're coming from so I know the places I should be getting my medical license so that I can reach you in the comfort and safety of your own home or your own office to help you on your journey to becoming immune confident. I can't wait to launch my practice in February of 2025 and really help you move the dial in your immune system health and healing. Until next time, make sure to hit subscribe so you don't miss the next episode and share this with a friend who may benefit, who maybe has dealt with hives or swelling. Thank you so much and take care.